But we're supposed to be talking today about why preventative medicine is so important. And we often hear the phrase, prevention is better than cure.
Oh, yeah, we have.
And definitely this applies to our health in every aspect of it. Most people believe that, they should only go to the doctor when they're sick.
When they're sick, they have a headache, they have a consistent pain, and so on, right?
But it's very important. Having a relationship with your healthcare provider is extremely important. And I want to emphasize that we don't just take care of people when they're sick. We're here to prevent them from getting sick. So it's important to establish a time during the year that you can go and get yourself checked. There are different things that we look at when we talk about preventative medicine. We speak about immunization or vaccination.
Vaccination, right.
We speak about cancer screening. We speak about screening for chronic diseases. If we can start with immunizations, there's a time in the year when we see a lot of cases of the flu.
Would that be around September,
September to March. That's the peak season for it. And around this time, we have a lot of visitors coming to St. Lucia, and they bring a lot of the flu virus with them.
Okay.
And so persons who work in the tourism industry and also healthcare providers, we get in contact with persons with these conditions on a daily basis. So it is not something that is very common in St. Lucia to take a flu shot, but in the U.S., you get your flu shot. Whether you could just go to the pharmacy, they can give it to you, your provider will give it to you. But it's a big thing because the flu affects everybody of all ages, and it is responsible for a lot of deaths in the U.S. annually, hundreds and thousands of deaths. People get complications, mostly pneumonia, and they die, especially the vulnerable people were immunocompromised
or something.
Compromised. So it's extremely important. So this is one thing that should be top on your list when it comes to prevention, your flu shot, especially if you work at the hotel, if you come into contact with foreigners, you work on the airport, or you're a healthcare provider, or you work at any kind of healthcare facility.
Yeah.
So this is important.
It's important.
To get your flu shot.
Doc, why do you think that people just don't go to the doctor overall? I know there could be several reasons, but what have you seen in your practice?
Out of fear, sometimes we have to give certain diagnosis. So mostly out of fear. Some people don't go because their schedule is busy. Some people figure if I'm not sick, why waste the money?
Yeah.
So they don't make it a priority. To continue on immunizations, the other one that's important is your diphtheria and tetanus shots. Those are extremely important. We usually give you a booster every 10 years. And this basically covers you in cases of you stepping on a rusty nail or you get stuck by a rusty object. That prevents you from getting serious infections. So that's another one you should also keep up with. Make sure that your diphtheria, tetanus shots are updated. We also have persons that over 65, we emphasize that they take the pneumonia vaccine. Pneumonia is something that claims the lives of several persons after 65. So your pneumonia shot is also very important. If you're immunocompromised, if you're diabetic, you also need to be vaccinated against pneumonia. We have the chicken pox and the shingles vaccine. Shingles affects the adults, elderly people, and people who are also immunocompromised. If you've had chicken pox before, if you get exposed again to the virus, you can get shingles, and shingles is very painful. Some people get shingles in the eye and it can cause blindness.
What are the symptoms does one have when they have shingles?
You have that burning rash because it affects your nerves. You can get it along your rib cage. You could get it around your eyes. But it's extremely painful. Just like chickenpox is painful, shingles is very painful. So it's important that you take your shingles vaccine. And those just a few of the many vaccines that are necessary if you're traveling to certain countries, African countries, South American countries. You might also need to take other
some vaccines and so on if you're traveling.
Right. So all of this comes under the umbrella of prevention.
Right. For parents, how about parents? What's the role of regular checkups for children or teenagers?
Yeah, the same when it comes to immunization, the same thing, because we have our protocol, our guidelines for vaccination for kids. So there's certain months they have to get certain shots, they have to get their booster shots, whether it be the MMR, whether it be diphtheria, tetanus, rubella, against varicella. They have their guidelines, so they would have to follow up closely either at the health center or their pediatrician for, their regular vaccination.
For patients that you have, or just listeners out there, Dr. Lansico, I know back in the day we had this schedule, this little thing that they gave us at the health center. Okay, you went to the doctor at that date.
They still do.
They still do it at the health centers.
It's just fancier, but they still do it. Yeah.
How about you, a regular person to you? How can one, keep a schedule of when the next appointment is for their children or for themselves? What would you suggest?
You just have to make notes of it. Have your own little notebook or on your smartphone. Make a note of when is the next appointment. Sometimes if you go to a private doctor, they may call you and let you know when is the next appointment for your child to get their vaccine. But it's up to you now to get that, have that information. It's your responsibility as well, so you don't miss the date, because vaccinations can prevent death and can prevent illness. In some cases, since we're on the topic of vaccination, I want to emphasize that not everybody that gets a vaccine will not get sick. Okay? However, the severity of the sickness will decrease if you're vaccinated. If you take somebody who has never been vaccinated against someone who has been vaccinated and they both get sick, the one who has the vaccine will get a minor version of the disease.
Of the disease, right?
Yes, because their body is already sensitized.
St. Lucia Doctor has lately we've been hearing the numbers of NCDs, chronic illnesses. Can you paint a picture of NCDs in St. Lucia? What conditions are most prevalent in our community, in our society?
When it comes to
non-communicable diseases.
Well, diabetes for sure. Diabetes, hypertension. We have had conditions that most times is and kidney problems a consequence of uncontrolled diabetes and high blood pressure. A lot of these things are either through lifestyles and also through genetics. A lot of us inherit the diabetes from families. There's a strong family history when it comes to hypertension and diabetes, and we see that throughout our population. So definitely I would say those two are top on the list, hypertension and diabetes. And how do you go about preventing this? The same way, you have to do your screening, your checkup, even if it's twice a year. Go get your blood pressure checked. You can go to your health center, you can go to your doctor, you can get your blood sugar checked as well.
Right.
You have to know where you are, especially if you have a strong family history, whether it be your mom, your dad. Make sure you have that checked, because these conditions do not always give symptoms. You can be diabetic and hypertensive and don't know, and all this time it's causing damage to your body. So I would say at least twice a year you should have your blood sugar checked, your blood pressure checked. Also, we see patients with high levels of cholesterol. Now, on our topic last week, we spoke about, the function of cholesterol and its benefits. But it's also detrimental to our health if we have a lot of cholesterol that the body is unable to use or get rid of. and that exposes you to a lot of cardiovascular disease, whether it be a heart attack, a
A stroke
stroke,
or so on.
whether it be, peripheral arterial disease that puts you at risk of losing a limb, or maybe you have a slow healing wound on your leg. So it's extremely important to get your checkup. So if the cholesterol, you could do this once a year. You go to the doctor, have them draw your blood, and you can do a lipid panel, which will give you an idea of what is, your good cholesterol and your bad cholesterol, your triglycerides are. And at least you know how to manage if it's something you need to go like reduce on your dietary intake, your intake of red meats and so on, and saturated fat. If you need to, do more cardiovascular activities. But this is extremely important as well.
We see a lot of people of late wearing technology, whether it be digital watches and they use apps. What role do you think technology and digital health, play in preventative care as well?
I wouldn't rely on it too much because a lot of these devices, they're not accurate. They might give you a little idea of what your blood pressure is, but they're not as accurate as if you go get it done professionally. In terms of home monitoring with blood pressure, the devices, it's better you use it than not have it at all.
Right.
I would recommend more for blood pressure monitoring. I would recommend more the ones where you place the cuff on your upper arm.
Why is that?
Because the blood pressure taken closer to your heart is more accurate.
Oh,
okay.
Some people do go for the
one on the wrist. It's fancier and stuff, but I prefer the one. You get a more accurate reading because it's closer to your heart.
Right.
So I would do that. Usually, you don't find patients doing their own blood sugar at home because they're afraid of the needles.
Right. Yes.
But you definitely, it's a good idea to own a blood pressure monitor. If the reading is elevated, we normally use a reading of, because it has two readings, one at the top, one at the bottom. So ideally the one at the top should be 120. And the bottom should be 80.
Right.
Okay. Anything above that, if the top is 120 to 139, you're already looking at, pre-hypertension or risk of you developing high blood pressure. Same thing if the bottom is between 80 and 90. So ideally, I would want that blood pressure to be 120 over 80 or less.
Okay. Have there been any instances where someone's blood pressure spiked? It's high and then it went back to normal because of something happening in their lives?
Our response to stress. Also, we have patients that come to the doctor and they have what we call white coat hypertension.
What's that?
Where, when they get to the doctor, they get very anxious and their pressure goes up. Right. Although in a normal person, the body has its own mechanism to prevent your pressure from spiking. Yeah, we have the body has a way to control everything. So it would prevent that. However, you find persons that would not need medication because that only happens at a time when they're under stress. Okay. Although they may be at a higher risk for developing high blood pressure later on.
Because of constant stress.
Yeah, so they need to get it checked. But it's quite possible that, some persons, when they're under stress, these things could happen, that the pressure can go up.
After a checkup, doctor, sometimes individuals live with a clear step. The doctor says, okay, depending on what the results are, this is what you need to do and this is what you need to stay away from.
Right.
But in some instances, I'm sure you have, seen that some of your patients just don't follow through. Why do you think it's so difficult?
Well, being consistent is something very difficult. We were not born doing that. Even trying to take vitamins. Sometimes I buy vitamins for myself and I don't even take it. It expires.
Are you serious?
Yeah.
Coming from you?
So I understand the challenges that patients have when it comes to taking medication. Imagine they don't even take it when they have a life-threatening serious condition.
Okay.
So just taking vitamins and drinking water, anything you have to be consistent with every day becomes a bit difficult. I think the only thing people are consistent with is partying and drinking alcohol. If they have to do that one, it's going to be hard for them not to do it.
Okay, I get you.
But stuff that is healthy for you, for whatever reason, it's always difficult to do. Eating healthy is difficult. Staying home and being good is difficult because I don't know, it's our nature to have some fun, but it is mostly the compliance is being consistent.
Yes.
And it doesn't matter if it's from exercising, if it's just to eat healthy or take your vitamins, So imagine when it comes to taking medications that may potentially have side effects and so on. So I believe most of the challenge is from being able to do it every day and developing a routine.
Right. And let's look at people ages 40s, 50s. What are the hidden risks that come from keeping routine care around age 40, age 50? Could you give examples of conditions that creep up around that age range?
Oh, yeah. The older you get, the more susceptible you are to certain chronic diseases. That's when all the joint pains come and you start getting arthritis. That's when you're more at risk of other chronic diseases. The body doesn't function the same as it used to. We don't fight illness as well, and then people become a little bit more sedentary. They don't, exercise as usual. They start eating and relaxing.
Right.
So you become more vulnerable to disease as you get older. We see persons also with family history, for example, with colon cancer. If you have a family history of colon cancer, you may, and that comes under prevention, you may want to do a colonoscopy between the age of 40 and 50.
A lot of people are afraid of doing that. Just the word alone scares
just the same, because, you have to do uncomfortable testing.
Yes.
But it is important because, colon cancer is a very, very serious type of cancer, very aggressive. So if you have a family history, and that comes under prevention, ask your family, your parents, about persons who have passed away, your uncles, your aunties, your grandparents. Ask about that.
It's very important to have that history, isn't it?
Yes, because certain diseases can skip generations. So you may find that your parents didn't get anything from their grandparents, but you end up getting it.
Right.
So genetic plays a very important role in disease, and it's good to have that conversation whenever possible, to see who in your family died from what and who suffered from what. So then that can guide you to say, okay, well, you know what, my uncle died from colon cancer. I'm 45. I need to do a colonoscopy. And this is extremely important. This is what we call preventative medicine. Don't wait until you see a blood in your stool, or you start having abdominal pain, or you have a diarrhea that doesn't go away. Prevention can help, go a long way in terms of, reducing risk of certain diseases.
Doctor, how often, when it comes to lifestyle diseases, right? How often do you find that small daily habits like loss of sleep, sometimes dehydration or stress play a bigger role than we realize?
Yeah, because those things, our body needs care and support, and sleep is very important. When you sleep, your body rejuvenates, cells grow, new cells grow. So a lot of things happened during sleep, and that is why it's important. And not just sleep, it's the quality of the sleep, the time you sleep as well. I mean, a lot of people are familiar with REM sleep, rapid eye movement sleep, and you can only accomplish that during a certain time. And that sleep is very, very important to restoring your body's functions. And lack of sleep can lead, or lack of quality sleep can lead to the appearance of a lot of chronic diseases. Our eating habits as well, and we haven't mentioned, but other lifestyle diseases, smoking, drinking alcohol, all of these things are connected to chronic disease, whether it be COPD and lung cancer. And not only cancers, lung cancer is associated with smoking. You have a lot of other types of cancer. That is even bladder cancer, pancreatic cancer. There are a lot of types of cancer that is associated with smoking. Alcohol with women. Alcohol increases the risk of breast cancer in women. And this is something else that comes under prevention, your breast cancer screening. Okay, so with the breast cancer screening, you could do this once a year. We usually do mammograms. In some cases, we do ultrasounds of the breast. That also comes under prevention. Prevention for men, there's a lot of information, so sorry I'm jumping from one to the other. For men, we have prostate cancer, which is a big thing, so we advise men from 40 and up to do their prostate cancer screening. They can do the PSA, which is prostate specific antigen. It's a blood test. And they can also have the digital rectal exam done by their provider to feel the size of the prostate. So pap smear is another one again, which has to be done. This is not when you reach 40 and up. This pap smear should be done from your early 20s, as long as you're sexually active, because we had a talk show on HPV and
Yes,
so
we
on.
did.
So it's important, especially if you're sexually active, you don't use condoms, you have to test for HPV and make sure that your pap smear does not show any cancer cells, because we know that HPV is the human papilloma virus, is responsible for the changes, the abnormal changes that occurs leading up to cancer of the cervix. So prevention, extremely important in terms of preventing sexually transmitted disease. While we're still on the topic, condoms. It is obviously not 100%, but it is safe enough to prevent you from getting a lot of the STDs that are out there, not just HIV. There are a lot of STDs that can ruin your life and ruin your partner's life. And not just physically, but psychologically. You may find yourself with a chronic STD, that STI, sexually transmitted infection, and when you finally find your soulmate, and you're going to plan a family, and you're like, how do I give this person a child without infecting them? So while you're young and active and all over the place and living carefree, it's important to know that if you catch anything while you're young, when you get older and you want to have a family, you're more mature, you have to think, how do I give my partner an infection while I try to get her pregnant? So it's the psychological aspect of it. Not all infections going to kill you. Some will not, but they will cause little symptoms off and on that can be bothersome, like herpes outbreaks every now and then. So it's important to think, how do I live a life in a way that I can be careful, not just for me, but for my loved ones.
But even with that, doctor, testing for STIs and STDs, people only think of HIV.
Yes.
And that's it. And when they go...
Or when they're sick, like the men, only when they have a discharge or they have a pain, it's painful when they urinate, they'll come and say, Doc, I really need to check for this and check for that. Women are a little bit more when it comes to screening and stuff. Women are a little bit more open and more consistent with screening. But overall, I think people need to take their health more seriously. And based on your lifestyle, you should know, okay, well, I'm at risk. Even if I'm with one person, but I don't know who that person is with. So you also always have to think about, just come, do your checkup, get it out of the way. At least okay, at the end of the year, I'm going into a new year. I am relatively healthy. I did my checkups. I did my breast cancer screening. I did my prostate screening. I did my whatever else you might need that applies to you at your age and your lifestyle. At least you know that your risk is less, and you have the information, and that's better than just living and not even considering going and find out about your health. Your health is your business. It's nobody else's own, so you have to take priority. We work hard and we party hard in our society, so definitely we have to ensure that we're healthy. That's important.
I definitely have to agree. And we're winding down now. For individuals who feel they're too busy for healthcare, what small manageable steps you think that they could make preventative care realistic for them?
Well, have a schedule. You go to work, you eat, you go out, you have a good time, you make time for family on the weekend, have a schedule and say, you know what, I'm going to choose a time every year. The beginning of the year is a good time to get it out of the way, to say, okay, well, for the month of January, let me get my blood test done. Let me go to my doctor, do all the blood tests I have to do. Let me check my pressure, my sugar, based on if I have any medical conditions. I need to know if my heart is working well, based on my family history and my age. I need to know if I should do my colonoscopy or my prostate screening or my breast cancer screening. So make a schedule and stick to it. So, every year, the same way some people have their schedule to go to the dentist for their cleaning, make a schedule and say, you know what, every year, this is the month I'm going to dedicate to this. Don't just let it go by and let it go by. And every month you say, well, you know what, I'll do it next month. I don't have the money now. So you plan financially. If you don't have healthcare insurance, you plan financially and you set money aside, whether it be $1,000 every year, you put that aside for your health screening.
And I definitely agree with that, because we spend money on so many other things. And if we really do think about it and you do the calculations, then you realize, hey, when it's time to go to the doctor and the doctor says, you know what, you have a list of tests to do, the money's already on the side. Because if you could save for Carnival or something else, you might as well, put some money aside for it.
Insurances, insurances, if you have life insurance for a certain amount, they require that you do certain checkups every year because they want to know if you're going to die on them tomorrow.
Yes.
So if they realize that you have a chronic condition, something that will take your life soon, they're going to increase your premium. Your
premium, yes.
So even them see the need for you to do it regularly. So as individuals, we have to take charge of our health. Our health is the only possession that we have. You cannot do anything. You cannot make the millions. You cannot enjoy life if you do not have good health.
Yes,
otherwise,
that is true.
We're wasting our time. So we do the little bit we can. When it comes to prevention, do not wait until you get sick. Do the little you can to get ahead.
And of course, the message is clear, with Dr. Lansico right here. Taking care of your health is more than just reacting when something goes wrong, because a lot of the times that's when we leave home and we go to see the doctor. It's about being proactive, being informed, and most importantly, being consistent.
That's
because you said that earlier.
And
I
need to take my vitamins, right? Don't just let them expire.
I know, right? And I need to take my vitamins as well. The same thing happens to me, and I'm sure the listeners as well. A checkup, again, Dr. Lansico, isn't just about tests. It's a conversation with your doctor. It's an opportunity to understand your body, what your body goes through, and a chance to make small changes that could have a big impact overall. And something you really mentioned is knowing your family's history. A lot of the times we don't know our family history, so it's important for us to know that as well. Prevention protects us, not only our physical health, but our mental well-being as well. So Dr. Lansico, thank you so much for being here as always. Any final words?
Well, I can be reached. My contact information, 725-7272. I can be reached during working hours. If you have any questions, you want to make an appointment, you're welcome to call. I operate in Rodney Bay. My private practice is in Rodney Bay, and I'm also in Castries. So, for today, as we said at the beginning, prevention is better than cure. It's best you know your health status. It's better, so you're better prepared for the next step.
Thank you so much. This has been the Wellness Zone right here on Rev-Up Slu 95.9 FM.
We're not just another radio station. Can you believe it? We're the one revving up St. Lucia.
This couldn't have come at a better time.
On Rev-Up St. Lucia 95.9 FM.